Okay, now how do I record? I don't. Well, I think I'll press this to record. Now, now now are we recording? I can just see. Apparently not. Um, oh, I think I might be recording now. I'll have to check and see. At any rate, but I can't hear myself talking, but I can see myself. Anyhow, I think that I'm going to try and dictate a short little story about some of my early memories of medical school days. Um, I entered medical school in September of 1944. Um, I I remember that one of the first things that I recall is that all of a sudden I was not the smartest guy around. There were some guys that were so much more brilliant, and I had to work hard. I have to tell you that. As a matter of fact, I recall there was a fellow named Billy Weil, and he was one of these brilliant guys. And two of my friends, Art Schulberg and I can't remember who else it was, studied with Bill Weil, and they studied, and because they studied with him, uh, they didn't need to study as much because he would read it for a while, study for a while, and he would know it, and so then they quit, and they almost flunked out because they were in my category. They had to work harder. Anyhow, I've told that story to many young students. I tell them that to emphasize to them that you have to know your own capabilities and you work as hard as you have to, not as far as this other guy may have to work. Anyhow, one of the things that I recall, I must have been in my second or third year, and at that time at the University of Minnesota, they first began a heart surgery program, but that was not the that was a program that was involving treating what's called blue babies, that is congenital heart disease. And at that time, they still were not doing coronary surgery, etc. They were not even touching the heart. What they were doing was manipulating the vessels around the heart because these congenital heart babies had some abnormality of the heart vessels around the heart, not in the heart. At any rate, because of this abnormality, they were cyanotic, that is, they were blue. And this new program at the University of Minnesota got people from Minnesota, from North and South Dakota, from Iowa, from Wisconsin. They funneled into this hospital to see whether they were eligible for this new procedure. And the routine was that the medical student interviewed the patient and usually, of course, their parents, because they were all infants, interviewed them and then ordered the appropriate tests. And then the next day, you, the medical student, presented the case to the professor. And I was one of the students that interviewed this family with the blue baby. It happened that my particular family had two children that were blue babies. One was, I recall, maybe 7, the other 5 or something like that. At any rate, I examined them and got the history, and then and ordered the appropriate tests. And the next day, the professor came, and I had to present the case to the professor. Well, I had missed totally the important history. The story that I had not elicited was that this older child, when it was 2, 3, 4 years old, had developed a sniffly nose or something, and saw the doctor, and the doctor ordered Argerol nose drops, that's silver nitrate nose drops, and it worked fine. And they kept on using the Argerol nose drops. But every day they put in a couple of Argerol nose drops. When the youngster came along a couple of years later, they figured they'd preventatively, I guess, they put silver nitrate nose drops in. So these two kids had been having silver nitrate nose drops in for pretty much all their life. And what I had not recognized is that these kids were not blue babies. They had a bluish tinge to their skin, but they were not cyanotic. I had not had enough experience to know the difference, to tell you the truth, and I did not recognize. Evidently, the professor did recognize that this was not cyanosis. This was argyrosis. Argyrosis, the silver, chemical symbol for silver is Ag, coming from argyrosis, I guess. And at any rate, what was happening is that silver was being deposited in the skin, and that's what gave this discoloration. I was not proficient enough to know the difference. My professor did, and that's what the story was. So I have seen 2 cases of argyrosis. None of my peers have ever seen a case of argyrosis. So that's my story. Well, we'll see how this works out. I think that I'll probably label this as medical medical school and interesting case. Now I'll stop it.